Hello friends, I am Dr. Nikhil Modi. I am a consultant respiratory medicine in Indraprasth Apollo Hospital, Delhi. Today I will be talking about tuberculosis. As you know, tuberculosis is one of the important diseases which we come across, especially in a country like India. Tuberculosis, what do we know about it? It is actually a disease which is caused by a bacteria called Mycobacterium tuberculosis. It is a slow growing bacteria. Hence, symptoms of tuberculosis noted are very subtle and slowly to progress. How do we come to know that we have to get workup for tuberculosis? It is important workup start as early as possible because controlling disease is possible if proper treatment is started. So what will be the symptoms which you will come across when you suffer from tuberculosis? Tuberculosis firstly can involve any part of the body, but most commonly it involves our lungs and the lining over the lungs. It is called as pulmonary tuberculosis. So most common symptoms which we come across are cough, which may be dry, or sometimes we may have some sputum along with it. Also, one of the important features which is seen is presence of blood in sputum. So if any time sputum is having blood, you should get alarmed and immediately consult a specialist. Cough is usually caused by most of the allergic symptoms or other infections. So how do we differentiate? It is actually not easily differentiable from other cough, but if your cough is persisting for more than 2 weeks, then our workup for tuberculosis becomes important. So if you have a long-term cough, you are having hemoptysis, then always consult a specialist and go for the workup for tuberculosis. Secondly, presence of low-grade fever which may persist. If you are having weight loss, your appetite is reduced for a long time, all these can be symptoms of tuberculosis. So in all these cases, a workup for tuberculosis becomes a must. So at that point of time, you need to consult a specialist. And it is easy to treat tuberculosis if it is identified, and drugs are good, but the treatment is at least for a period of 6 months, which you have to take regularly. Otherwise tuberculosis may become resistant, the bacteria may become resistant, and then it is difficult to treat. It is called as MDR tuberculosis, but now we have a treatment for that, but the treatment may continue for 2 to 2.5 years, and it requires a constant monitoring. There can be side effects from the drugs, but if you are in proper supervision, then that side effects can be minimized and the disease can be cured 100%. So any symptoms which may point out toward tuberculosis, you should not ignore and consult a specialist as soon as possible. This is the basic crux about the tuberculosis, and I want to just say, just be ready for it, and it can be treated easily. For any queries from my point of view, if you want to ask, you can visit me at Indraprasth Apollo Hospital, Delhi, or you can contact me online on Lybrate platform. Thank you.